12 warning signs of a head tumor and when to see a doctor. Most brain tumors do not actually originate in the brain but come from other parts of the body and then spread to the brain. These tumors are called metastatic brain tumors or secondary brain tumors. On the other hand, tumors that form directly in the brain are called primary brain tumors. Whether primary or secondary, both can cause serious complications if not detected and treated in time. Next, we will present 12 common symptoms of brain tumors. Number 1. Headache. Headaches are perhaps the most common symptom in people with brain tumors. In the early stages, a brain tumor may not cause any noticeable symptoms. It is only when the tumor grows large enough to put pressure on the brain or nerves within the brain that it starts causing headaches. If you have a brain tumor, you are likely to experience frequent headaches. These headaches may be accompanied by nausea and other neurological symptoms. The pain may worsen with physical activity, coughing, changes in posture, or when pain relievers are ineffective. However, not all headaches are caused by brain tumors. If your headaches are becoming more severe, don't hesitate to see a doctor for an examination and timely advice. Number 2. Convulsion. Brain tumors can put pressure on nerve cells, disrupting the brain's electrical signals and leading to seizures, also known as epilepsy. In fact, about 50% of people with brain tumors will experience at least one seizure. When a seizure occurs, you may experience signs such as temporary loss of consciousness, confusion, or even falling down. However, it's important to note that seizures are not always caused by brain tumors. Sometimes they can result from other neurological issues, brain-related conditions, or medication withdrawal. Number 3. Personality changes or mood swings. Brain tumors can alter brain function, affecting your personality and behavior. They may cause unexplained mood swings. These changes can be caused by the tumor's location in specific parts of the brain. For example, in the frontal lobe, which regulates emotions and impulse control, or in the temporal lobe, which processes information from the ears, maintains balance, and regulates emotions such as anxiety, joy, and anger. These changes can appear in the early stages of a brain tumor. Number 4. Memory loss and forgetfulness. When a brain tumor is located in the frontal or temporal lobe, memory problems may occur. A tumor in the frontal lobe can also affect your reasoning and decision-making abilities. If the tumor is present in these areas, you may have difficulty concentrating and may be easily distracted. This could be a sign of memory problems caused by a brain tumor. However, mild memory issues can also stem from causes other than a brain tumor. For example, vitamin deficiency, side effects of medications, or other brain disorders can also produce similar symptoms. If you experience this condition, consult a doctor to determine the cause and find the appropriate treatment. Number 5. Fatigue. When you constantly feel tired, your body becomes weak, and your limbs feel heavy, it could be a sign of a brain tumor. This fatigue may also make it difficult to concentrate and cause your mood to become irritable or negative. However, it's important to note that fatigue is not always due to a brain tumor. Other causes, such as autoimmune diseases, neurological disorders, anemia, or other medical conditions, can also lead to similar fatigue symptoms. If you experience prolonged and unexplained fatigue, consult a doctor to determine the exact cause and receive the appropriate treatment. Number 6. Depression. Depression can be a significant symptom when you have a brain tumor and may manifest in various ways. You may feel persistently sad without any clear reason or feel that everything around you has lost its meaning. Or you may lose interest in hobbies and activities you once enjoyed and no longer want to do anything. Frequent fatigue and insomnia can also be signs of depression. More severe symptoms include thoughts of self-harm or suicide, along with feelings of guilt and worthlessness. If you experience these symptoms, especially if they persist or become severe, seek help from a doctor or mental health professional. Number 7. Nausea and vomiting. Nausea and vomiting can occur in the early stages of a brain tumor due to hormonal imbalances caused by the tumor. As the brain tumor develops, it can increase pressure within the skull. This increased pressure can stimulate the vomiting center in the brain, leading to feelings of nausea and vomiting. However, nausea and vomiting are not always caused by a brain tumor. Other potential causes include food poisoning, the flu, or even pregnancy. Therefore, if you experience these symptoms, it's important to identify the exact cause. If nausea and vomiting persist or become severe, consult a doctor for timely examination and treatment. Number 8. Numbness and tingling. A brain tumor can cause sensations of numbness and tingling in the face, arms, hands, legs, and feet. This occurs because the brain plays a crucial role in controlling sensations throughout the body. The brain receives signals through nerves and the spinal cord, which then travel up the spinal cord and brainstem, finally reaching the brain for processing. When a brain tumor blocks this signal pathway, it can result in numbness and tingling. Numbness and tingling caused by a brain tumor usually affect only one side of the body. The specific location of the symptoms will depend on the tumor's location. Number 9. Vision and hearing problems. Visual and auditory problems can also occur when you have a brain tumor. If the tumor is near the optic nerves, it can compress or damage the optic nerves. This will disrupt the transmission of signals from the eyes to the brain, potentially causing blurred vision or vision loss. Additionally, if the tumor affects areas related to hearing, you may experience symptoms such as tinnitus or changes in hearing ability. Depending on the size and location of the tumor, these symptoms can vary and impact your quality of life. Number 10. Dizziness. Dizziness is often caused by issues in the brain, particularly in the brainstem or cerebellum. When a tumor develops in these areas, you may experience dizziness, loss of balance, or a sensation that everything around you is spinning. Dizziness can make you feel unstable or prone to falling. Additionally, it can affect your ability to perform daily activities. If you experience frequent or severe dizziness, consult a doctor for timely examination and treatment. Number 11. Hard to say. A brain tumor can affect the areas of the brain responsible for controlling speech and communication. Depending on the tumor's location, you may experience difficulty articulating words due to muscle weakness or trouble controlling the muscles needed for speech. Additionally, you might encounter issues such as slurred, slow speech, or changes in voice volume. If you have difficulty speaking, consult a doctor promptly for diagnosis and timely treatment. Number 12. Mobility issues. A brain tumor can affect the brain regions responsible for balance and coordination. If you are feeling increasingly clumsy and have difficulty maintaining balance, such as being prone to falls or tripping, it could be a sign of a brain tumor. This may lead to loss of sensation or movement in the arms or legs, or difficulties in maintaining balance. If you experience these symptoms, consult a doctor for prompt diagnosis and treatment. When should I see a doctor? Even if you do not have a brain tumor, these symptoms still need careful monitoring. If the doctor cannot determine the cause of your symptoms, they may refer you to a specialist for additional tests to accurately identify the cause. When you see the doctor, inform them if you have been exposed to radiation. Those who have been exposed to ionizing radiation are at higher risk for developing brain tumors. Additionally, if your family has a history of brain tumors or genetic syndromes, this also increases your risk of developing a brain tumor. Provide the doctor with all necessary information about your medical history. The specialist may request blood tests to look for tumor markers, which are substances released by tumors into the blood and related to certain types of tumors, helping confirm the presence of a tumor. The doctor may also request imaging tests, such as a CT scan or MRI, to accurately identify the tumor. While waiting for test results, the specialist will perform a neurological assessment to check for changes in balance, coordination, mental state, hearing, vision, and reflexes to determine which part of the brain may be affected by the tumor. If a brain tumor is confirmed, treatment will depend on the type and condition of the tumor. Treatment methods may include surgery to remove the tumor, radiation therapy, or chemotherapy to shrink the tumor before surgery. You now know the 12 symptoms of a brain tumor and when to see a doctor. Pay attention to these symptoms. If they become persistent or worsen, see a doctor. The doctor will guide you on the necessary tests and appropriate treatment for your condition. We hope this video has been valuable to you. If you have any additional thoughts or information, please share them with us in the comments below. Remember, life is better when you take care of your health.